Good morning, everyone. Thanks for joining us today as we discuss plans for the upcoming flu and COVID-19 vaccination campaigns for Newfoundland and Labrador. But before I start, I'd like to send out a happy Environmental Public Health Week to all our environmental public health professionals in the province. The environment has been and will continue to be a key social determinant of health and well-being, and environmental health officers are a critical part of our public health system. And most of us don't even realize the work that they do because they do it so well that we take it for granted. So thank you to all the environmental public health officers out there for standing up to protect everyone's health each and every day. Now back to vaccines. As the weather starts to change and days begin to feel like they're getting or are getting shorter, most people's minds tend to be on Thanksgiving plans or Halloween preparations. But for us in public health, signals we need to start thinking about preparing for respiratory virus season. So we all know this time of year tends to see a spread of respiratory viruses as schools head back in session and activities tend to move indoors and holiday gatherings increase. And like last year, this cold and flu season, we expect to see both influenza and COVID-19 circulating at the same time, in addition to other respiratory viruses such as RSV. So public health's priority is to reduce the spread of these viruses and thereby preventing severe illness and hospitalization associated with many of them and preserving health system capacity. As all of you know from the last few years, we have the tools we need to stay healthy and reduce the spread of illness. So stay home if you feel unwell, cover your coughs and sneezes, and wash your hands often and well. Of course, vaccination against flu and COVID-19 is an essential tool to reduce the spread of these viruses. Vaccines are safe and effective and continue to be the best way to protect yourself and others from severe illness. To minimize the impact of these viruses this season, I encourage everyone who is eligible to get the influenza and COVID-19 vaccinations. The flu vaccine will be offered to all individuals 6 months of age and older. It is strongly recommended that those who are at higher risk for severe influenza get the vaccine this fall, and that includes children aged 6 months to 5 years, adults 65 years of age and older, residents in seniors congregate living, individuals with certain medical conditions, for example, heart disease, lung disease, or immune compromise, and of course there are many others. I encourage you to check our website, and individuals who are pregnant, and individuals who identify as First Nation, Inuit or Métis. On September 12th, 2023, Health Canada authorized Moderna COVID-19 Spikevax vaccine, specifically targeting the Omicron XBB.1.5 subvariant for use in people 6 months of age and older. The National Advisory Committee on Immunization recommends a dose of XBB.1.5 containing COVID-19 vaccine to people 6 months and older this fall. This new formulation is expected to provide better immune response against currently circulating variants compared to vaccines previously in use. So individuals 6 months of age and older are eligible and should receive a fall dose of the COVID-19 vaccine if it has been 6 months since your previous vaccine or COVID infection, whichever is later. And this is regardless of the number of doses of vaccine that you have received previously. Those at high risk for severe disease are strongly recommended to get the vaccine when eligible, and those include adults 65 years of age and older, residents of long-term care and other senior congregate living facilities, individuals with underlying medical conditions, again, for example, heart disease, lung disease, and immune compromise, and again, check our website for a full list, pregnant individuals, and individuals from First Nation, Métis, and Inuit communities. Vaccination clinics for flu and COVID will begin Monday, October 16th, and appointments will be made available online starting October 10th through Health Zone clinics by visiting Time for the Shot website. Please check in periodically for availability at any of these vaccine sites as appointments are continually being added as vaccine supply is received. Additionally, appointments can also be made through participating pharmacists and physicians. For those eligible for both vaccines, it is safe to receive both flu and COVID-19 vaccines at the same time. And both vaccines are proven safe and effective ways of reducing the spread of influenza and COVID-19 and the incidence of severe disease from these viruses. Newfoundlanders and Labradorians believe in vaccination as a public health measure. We have seen this in our exceptional COVID-19 primary series uptake. We have seen it in over 95% of parents choosing to protect their children against measles and other preventable diseases. And we have seen it in the way we have led the country in cervical cancer prevention through HPV vaccination. So I know that you will step up once again to protect yourselves, your loved ones, your communities, and our health system by making the choice to get vaccinated against flu and COVID-19 this fall. And I thank you all in advance. And I'll now take any questions.
Has anything changed in terms of public health's approach to the vaccine campaign as opposed to previous years?
I mean, right now, what we're saying is that everybody should have this vaccination, regardless. We're still encouraging everybody 6 months of age and older to get it. So in that way, it's still very much the same. Our approach is very much the same in that we want everybody to be protected as much as possible.
Dr. Fitzgerald, so some people got the vaccine, then they got COVID, and they're like, man, that wasn't so bad. I don't need this vaccine this time around. What would you say to those people?
So fair, that may be absolutely true for some people. What we do know is that the immunity wanes over time. So if it has been quite a while since you had either COVID or the vaccine, you could have more severe disease this time around. So there's no way to really know right now what will happen in that regard. And what we do know is that this, updating your immunity with a vaccination would certainly be beneficial.
Kind of snowballing on that, I'm wondering if you are concerned that over time people are going to say, oh, it's just another virus. I don't care. I'm not getting the booster anymore. Do we have concerns, or do we think people are still going to go out and get the COVID booster this year? Or do you hope so, at least?
Yeah, so certainly I really do hope that people will get the vaccine. I think, it's still, COVID is still new. We're still learning about it. We're still learning about how the virus behaves and how it changes over time. And what we have seen up to this point is that the vaccine is effective at preventing severe disease. And I think we only have to think back to the early stages of the pandemic to understand what severe disease could be like. And so, we don't know what's going to happen in the future, and I certainly wouldn't want to predict based on what we know right now. But, at this point, I think encouraging people to get the vaccine as they become eligible for it is the best way to protect ourselves.
What do we know about the prevalence of COVID in the community right now?
We certainly are seeing a little bit of an uptick in the community at the moment, and hospitalizations are slightly going up slightly over the past couple of weeks as well. Still not at levels that we saw sort of in the height of things, but, and not causing alarm, but we're certainly paying close attention to it. But not unexpected, really, given what we know about respiratory viruses as the weather gets colder and kids go back to school and people start to move inside and that sort of thing. So yeah, we're seeing a little bit, and that's being seen really everywhere across the country. So,
do you have any data on the number of people with long COVID in the province?
I don't have that information, but that tends to be more in acute care, really, than public health at this stage.
Do you know if there will be any vaccine rollout in like K-12 schools, or will parents have to book an appointment for their kid and themselves to go to a clinic?
Yeah, so certainly the vaccine rollout will vary a little bit depending on where you are in the province and what works best to, the public health teams have had a lot of practice at this now, and they've been doing it for many years, and with flu even before COVID. So they really know what works in their areas. And so we like to leave that expertise up to them to make those decisions about what works best. So, there may be we may see that some schools have people going in, but that may not happen everywhere because it's not always possible. And, our goal for the campaign in the beginning, in the early stages, is really to get as many people vaccinated as possible in as short a time as possible, so that everybody's protected, so that public health's work is disrupted less, because there's a lot of work that has to go on hold so that we can bring out these really massive vaccination campaigns. So, you know, our goal really is to try to get as many people done in the shortest amount of time possible. And, you know, that mass clinics are really the quickest way that we can do that. So that's where the focus is initially.
You said, you know, Newfoundlanders believe in vaccination, but I took a look at the COVID dashboard before I came, and it said the vaccination rate, like for folks who are like up to date for the entire population, I want to say it was like 20-something%. You know, are you concerned about that, or what do you make of that percentage?
Yeah, so I mean, certainly we consider up to date as having a vaccine in the last 6 months. So a lot of people, if they've had COVID, they may not be getting a vaccine, and there's no way for us to know everybody who's had COVID, obviously. So that's one thing. I think it's fair to say that there probably has been a bit of vaccine fatigue up to this point. You know, I think right now we're really trying to make a shift to say we want people to get this latest version of the vaccine, and it's certainly the one that we expect will be the most protective. And so I think this fall is a little bit of a reset for us in that regard, and hoping really just to look at it in much the same way as we do flu and say, you know, what percentage of people have gotten vaccinated this fall. So, yeah, we certainly want people to step up, but looking at that number just in and of itself, you know, there's lots of other things to consider as to why it's where it is, right? No other questions? Great. Perfect. Thanks, guys. Oh.